ओके, सो SK21 वॉल्यूम 2 का लास्ट पेपर है एनेस्थीसिया का, ठीक है। और विच NSAID इज़ मोस्ट लाइकली टू सेलेक्टिवली इनहिबिट COX-2 एंड COX-1 इनहिबिटर। COX-1 और COX-2 को सेलेक्टिवली इनहिबिट कौन करवाता है? दैट इज़ योर मेलॉक्सिकैम। What is the primary physiological effect caused by stimulation of beta 2 adrenergic receptor? तो beta 2 adrenergic receptor में आपके साथ vasodilation होती है. A chemical engineer is analyzing different types of combustion events. He notes an explosion is specific type of combustion which is characterized by, तो explosion में क्या होगा? Reaction velocity and heat generation greater than heat removal. Halothane is a calcium channel blocker caused by refractory hypotension because it has, तो halothane के साथ क्या है? Because it has synergistic effect on calcium channel blockers. 65-year-old patient who has been on long-term chemotherapy develops progressive shortness of breath and a persistent dry cough. Imaging पे reveals interstitial lung disease consistent with pulmonary fibrosis. Which of the following drug causes pulmonary fibrosis? तो ये आपके साथ मेथोट्रेक्सेट है। 50-year-old patient, history of HIV, क्लिनिक में आया, कफ है, डिस्मिया है, is diagnosed with pneumonia and started on standard antimicrobial drug. The mechanism of action will be, तो mechanism of action is your folic acid synthesis inhibitor, ठीक है। तो ट्राइमेथोप्रिम सल्फामेथोक्सिजोल जो है वो इनहिबिट करते हैं सिंथेसिस ऑफ फॉलिक एसिड को in the microorganism, a pathway essential for its growth. Medical student is reviewing the anatomy of eye and is asked about the location of watery fluid and maintains the intraocular pressure. The aqueous humor is present in, तो aqueous humor कहाँ पे होता है? Both anterior और posterior chamber में. A patient with RTA and brain injury presenting with hypotension will likely have which electrolyte disturbance? उसमें कौन से electrolyte की disturbance होगी? Hyponatremia होगा. Patient with hypoparathyroidism undergo lignocaine anesthesia develop carpopedal spasm. तो carpopedal spasm hypocalcemia की वजह से होता है. Mechanism of action of vancomycin क्या है? कि it will inhibit cell wall synthesis. Macular dystrophy feature abnormal accumulation of which substance due to dystrophin deficiency? Dystrophin deficiency की वजह से there is protein defect, ठीक है। accumulation of substance due to dystrophin deficiency is protein. A physician is evaluating a patient with persistent diarrhea who presents with hypokalemic metabolic acidosis. The physician is trying to pinpoint the anatomical source of electrolyte imbalance. तो persistent diarrhea with hypokalemic metabolic acidosis भी है, और trying to pinpoint the anatomical source, तो ये pancreas लग रहा है, नहीं, option C है, that is your colon is responsible for absorbing water, ठीक है। अच्छा, is trying to pinpoint the anatomical source of electrolyte, अच्छा ये इसका कीवर्ड यहाँ पे है, इलेक्ट्रोलाइट एबनॉर्मेलिटीज़ की बात की गई है। तो इलेक्ट्रोलाइट एबनॉर्मेलिटीज़ के लिए कोलॉन रिस्पॉन्सिबल होता है। इट्स फॉर रिस्पॉन्सिबल फॉर एब्जॉर्बिंग वाटर एंड सॉल्ट एंड एक्सक्रीटिंग पोटाशियम एंड बाइकार्ब. डायरिया लीड्स टू एक्सेसिव लॉस ऑफ बाइकार्ब एंड पोटाशियम. द लोअर लिमिट ऑफ flammability for anesthetic vapor or gas dependent primarily upon the concentration of the substance. तो स्पेसिफिकली ये क्या होगा? दैट इज़ लो गैसियस मिक्सचर. द लो flammability limit is the minimum concentration of vapor or gas in the air required for ignition to occur. Below this concentration the mixture is too lean to burn. Anesthesiologists decide to use a esmolol beta blocker to rapidly control patient heart rate and blood pressure during a brief surgical stimulus due to its characteristic of, तो esmolol का short duration होता है, ठीक है। The hormone which decreases small intestine motility, तो that is your secretin, small intestine की motility को decrease करता है। The reversible change in skin color observed after tanning is primarily due to increased activity of which amino acid precursor? तो tanning किसकी वजह से होता है? ऑप्शन ए, टायरोसिन की वजह से नॉन एसेंशियल है। द स्किन पिगमेंट मेलानिन रिस्पॉन्सिबल फॉर टैनिंग इज सिंथेसाइज्ड फ्रॉम अमीनो एसिड टायरोसिन by melanocytes, and increased melanin is gradually broken down, returning the skin to its original color. The amplitude of the depolarizing wave decreases with the amplitude of depolarizing decrease with hyponatremia. Patient 1 year post chemotherapy and modified radical mastectomy for breast cancer presents with new onset constipation and generalized body pain. Imaging पे bony metastasis. The likely electrolyte imbalance या disturbance कहाँ है? That is in your hypercalcemia. 30-year-old female who is 20 weeks pregnant presents to the ER with acute onset of severe abdominal pain localized over the uterus accompanied by low-grade fever and mild uterine bleeding. An ultrasound confirms the presence of large intramural uterine fibroid that was identified during the first trimester. What is the most likely degenerative change within the fibroid as a result of pregnancy? So that is your that is your red degeneration. ठीक है, तो ये आप पढ़ लें. दैट इज़ योर रेड डिजनरेशन. रैपिड ग्रोथ ऑफ फाइब्रॉयड ड्यू टू हार्मोनल या वेस्कुलर चेंज इन प्रेगनेंसी आपके साथ इस्कीमिया इन्फार्क्शन कॉज करवाता है, लीडिंग टू अ फॉर्म ऑफ एसेप्टिक नेक्रोसिस जिसे हम रेड डिजनरेशन कहते हैं. A patient with severe volume depletion hypokalemia presents with metabolic alkalosis, but their urine is paradoxically acidic. What is the fluid of choice of paradoxical aciduria? Fluid of choice of paradoxical aciduria is 0.9% NaCl. What is the maximum permissible exposure to NTO allowed by the operating theatre for an 8-hour period or recommended by major health organization? तो ये कितना है? That is your 25 ppm. The ratio of mass of water vapor to the volume of air, often expressed as percentage or mass per volume, इसको हम क्या कहते हैं? That is humidity. Humidity is a term used to describe the concentration of water vapor present in the air, which can be quantified in various ways. Which spirometric creation is most indicative of chronic airflow limitation essential for diagnosis of chronic COPD? So that is COPD FEV1 by FVC less than 0.70. पोस्ट और प्री अगर होगा तो वो होगा, वरना ऑप्शन ए करेक्ट है. अ पेशेंट आर्टीरियल ब्लड गैस जो है 7.30 एसिडोसिस, रेस्पिरेटरी एसिडोसिस बाइकार्ब भी है, तो मिक्स्ड पैटर्न नज़र आ रहा है. तो ये आपके साथ रेस्पिरेटरी एसिडोसिस है विद पार्शियल रेस्पिरेटरी एसिडोसिस. दूसरे कौन से में है? दूसरे कौन से में भी नहीं है, तो दैट इज़ बी. A trauma patient presents with cervical spine tenderness and restricted neck movement. What is the safest and most appropriate technique to establish a definitive airway while maintaining cervical spine immobility? So that is your awake flexible bronchoscope intubation. A common electrolyte abnormality seen in ICU patient with severe head trauma and elevated ICP. So that is your option number C, hyponatremia. Patient को CHF है with hypotension, signs of hypovolemia. Which intravenous fluid is preferred for cautious resuscitation to maximize intravascular volume expansion while minimizing the risk of pulmonary edema? So that is your 5% albumin. Which clinical sign is not typical feature of lateral medullary syndrome, which result from an occlusion of pica or the vertebral artery? That is your contralateral limb weakness. How do ACHE inhibitor temporarily improve muscle strength in a patient with myasthenia gravis? So that is your option number C. They increase the concentration of ACH at the motor end plate. ठीक है, मैं डायरेक्टली आंसर बोलता हूँ क्योंकि दिस इज़ रैपिड रिवीजन क्लास. अगर आपने इसको ख़ुद गेस करना है, यहाँ तक मैं ले आता हूँ, तो आप इसको यहाँ पे पॉज किया करें और ख़ुद गेस लगा के फिर इसके साथ यू शुड गो विद द फ्लो. फिर है which of the following drug is a classic example of a compound that is actively transported and secreted into the renal tubule by organic anion or cation transporter rather than just filtered? तो ये आपके साथ है ऑप्शन ए, बेंजीथीन पेनिसिलिन. ठीक है, बेंजीथीन पेनिसिलिन. तो बेंजीथीन पेनिसिलिन are predominantly eliminated from the body by active tubular secretion in the PCT via the organic anion transporter system. फिर है the cell bodies of preganglionic GVE fibers of the vagus nerve which provide parasympathetic innervation to the thoracic and abdominal viscera are located in which brainstem? So they are located in the dorsal motor nucleus. The overall rate of gas flow through a narrow tube or airway primarily depends on which physical property of the gas? So they depend upon option number D, both density and viscosity. A patient with 10-day history of fever now presents with sharp retrosternal chest pain that is not related to respiration but may be positional. Which structure is most likely source of this pain? तो इस पेन का source is pericardium. फिर है at which point in the cardiac cycle does the pressure within the aorta reaches its maximum peak value? तो it reaches rapid ventricular ejection में maximum peak value तक पहुंचता है. When measuring systemic arterial blood pressure, how does the typical systolic pressure measured in the peripheral artery like dorsalis pedis compare to the pressure measured in the central artery like the radial artery? तो amongst the following ये कौन सा होगा that will be systolic pressure is greater than in the radial artery? फिर है which type of cell is the major source of thromboxane A2, a potent vasoconstrictor and platelet aggregator that is crucial for primary hemostasis? तो ये क्या है? ये आपके साथ है platelets. Sacrococcygeal teratoma, a germ cell tumor found at the base of the coccyx, is believed to arise from remnant of which structure that normally regresses completely during embryonic development? तो ये आपके साथ कौन सा होगा? That will be primitive streak. A phenotype female patient presents with short stature, a webbed neck, shield chest and primary amenorrhea. What is the most likely chromosomal abnormality? तो ये आपके साथ टर्नर सिंड्रोम हो गया. The primary, इन सब की एक्सप्लेनेशन मैंने पिछले वीडियोस में दी है तो इसलिए हम ये लास्ट पेपर को जल्दी से जल्दी को कवर करने की कोशिश करेंगे. Primary control center responsible for regulating appetite including the sensation of fullness and the drive for food intake are located in which brain structure? So they are located in your hypothalamus. A patient presents with ST elevation and second degree AV heart block, echocardiography पे hypokinesis of the inferior posterior wall of the left ventricle and possibly the adjacent inferior wall of the left atrium. Which coronary artery is most likely affected? तो आपको जो है ST elevation in second degree AV heart block नज़र आ रहा है. It shows hypokinesis of inferior posterior wall of the left ventricle and possibly the adjacent inferior wall of the left atrium. तो left atrium की बात आ गई, ठीक है. उसमें कौन सी आर्टरी होगी? दैट इज़ योर ऑप्शन नंबर ए, occlusion of the RCA. ऑप्शन नंबर ए इज़ RCA. तो दैट इज़ occlusion of RCA आपको classically causes inferior wall MI. Patient with long-standing rheumatoid arthritis develop interstitial lung disease and pulmonary fibrosis if they are on DMARD. Which specific medication is most common cause of drug-induced pulmonary toxicity resulting in fibrosis? That is your TNF alpha, that is your methotrexate. ठीक है, methotrexate agent है for rheumatoid arthritis and is a well-known cause of pulmonary toxicity जिसमें hypersensitivity pneumonitis आता है और rarely slowly progressive fibrosis भी होती है इसमें. Goodpasture syndrome characterized by anti-GBM causes hematuria, hemoptysis. कौन से टाइप की hypersensitivity है? पिछले लेक्चर में पढ़ा है Goodpasture type 2, PSGN type 3. Which anti-epileptic drug is well known for causing adverse cosmic effects, specifically hypertrichosis and gingival hypertrophy? की बात आ गई, hypertrichosis की बात आ गई तो आपने phenytoin पिक करना है. फिर है what is the universally accepted drug of choice for all stages of syphilis caused by bacterium Treponema pallidum? तो Treponema pallidum क्या cause करवाएगा? That is penicillin G. If a patient with asthma requires treatment with beta adrenergic receptor blocker, Which agent would be safest choice due to its relative cardioselective property? तो metoprolol is cardioselective. कार्डियोसेलेक्टिव बीटा ब्लॉकर में आपके साथ मेटाप्रोलोल एटिनोलोल आते हैं. Beta 1 receptor in the heart, making them safe choice in patient with asthma as they are less likely to cause dangerous beta 2 mediated bronchoconstriction and non-specific and non-selective agent rather than non-selective agents. The net metabolic effect glucocorticoids का क्या है ग्लूकोज पे, ग्लूकोज hemostasis पे is to raise blood sugar. Which of the following is direct mechanism by which glucocorticoid achieve this? तो कौन सा mechanism है by which glucocorticoid achieve this? Decrease peripheral uptake of glucose. A patient presents with anosmia. The cell is in the roof of the nasal cavity that is responsible for initial detection of odors and transmit this signal. Are what structure type of neuron? They are bipolar neurons. Which severe long-term side effect is characterized by chronic high-dose systemic corticosteroid therapy due to suppression of osteoblast function and increased bone resorption? तो ये आपके साथ osteoporosis होगा. In case of infective endocarditis, an embolus from the heart valve travel to the spleen. Examination of the excised spleen section shows a wedge-shaped pale white area due to interrupted blood supply. Which pathological process is seen in this area? तो इसमें आपको मिलती है coagulative necrosis. Patient presents with severe localized swelling and pain around the one eye accompanied by severe headache and fever. They recently had untreated furuncle on nose. What is the most likely threatening intracranial complication? So that is your orbital cellulitis. When a sudden painful stimulus trigger the withdrawal reflex, which sensory tract is activated to rapidly relay the pain signal to the brain and conscious perception? That is your spinothalamic tract. Visceral pain originating from epigastric region is carried back to the spinal cord by which specific sympathetic nerve? So that is carried by the greater splanchnic nerve. A patient presents with their wrist in an extended position but they have difficulty with flexion of proximal interphalangeal joint and distal interphalangeal joint of the finger. Which nerve is damaged? तो इसमें कौन सा nerve damage है? That is your ulnar nerve. ठीक है. फिर है in susceptible individual with defect in muscle ryanodine receptor. Which specific class of muscle relaxant is most common trigger for life-threatening condition? Malignant hyperthermia. That is your depolarizing agents. Following administration of high-dose local anesthetic during nasal septoplasty, a patient experiences perioral numbness or lightheadedness है. What is the cause of these symptoms? इसका cause क्या है? That is central nervous system toxicity. A local anesthetic solution combining lidocaine with adrenaline is widely used to prolong anesthetic duration and achieve local hemostasis. The use of this combination is considered an absolute or severe relative contraindication in a patient with which of the following cardiovascular condition? So that is your amongst the following क्या है? That is your ischemic heart disease. In stratified analysis, particularly when performing t-test, the primary purpose of calculated t-value क्या है? तो among the following, that is to determine the difference between two groups. The internal capsule is a structure in the brain that connects the cerebral cortex to the brain stem and spinal cord. What is the primary structure composed of? तो primary structure आपके पास composed होता है white matter से. Patient presents with recurrent episode of PSVT and an ECG showing short PR interval and delta waves. This is diagnostic of Wolff-Parkinson-White syndrome. What is the underlying electrophysiological cause? Underlying electrophysiological cause क्या है? Presence of an accessory electrical pathway bypassing the AV node होगा. ये हमने already explain किया है. Which electrolyte abnormality can acutely prolong the QT interval on ECG and is a strong risk factor for developing the life-threatening ventricular arrhythmias torsade de pointes? तो ये हाइपोमैग्नीसीमिया और हाइपोकेलीमिया सबसे अच्छा ऑप्शन बन रहा है, ऑप्शन बी टॉर्सिड डी पॉइंटीज में. डिक्लोफेनिक सोडियम इज एन एसिड known for its analgesic and anti-inflammatory effect. which enzyme is primary target for this inhibition? तो कौन सा enzyme है? That is both COX-1 and COX-2. Which of the following drug causing tachycardia at normal dose? तो tachycardia at normal dose is caused by isosorbide dinitrate. In management of severe pain associated with acute pancreatitis, which opioid analgesic is often preferred? So that is your pethidine. Stimulation of beta 1 adrenergic receptor primarily found in the heart causes which physiological effect? तो आपके साथ कौन सा physiological effect cause करवाएगा? tachycardia and increased contractility. Stimulation of alpha 1 adrenergic receptor causes which physiological effect? So it will cause vasoconstriction and mydriasis. A patient ECG shows flat or reduced T wave height and potentially ST segment depression. This constellation of finding is characteristic of which electrolyte abnormality? It is characteristic of hypokalemia. In management of heart failure with reduced ejection fraction, which class of medication is considered the cornerstone of therapy and may be used as initial monotherapy before combination therapy? तो कौन सा यूज़ करेंगे? That is your captopril. Canagliflozin is an oral antidiabetic drug used to treat type 2 diabetes. What is the specific mechanism of action in the kidney? तो canagliflozin का mechanism of action in kidney क्या है कि it inhibits SGLT2 सोडियम ग्लूकोज को ट्रांसपोर्टर 2 को इनहिबिट करता है. ठीक है, SGLT2 इनहिबिटर है और कैनाग्लिफ्लोजिन का काम यूटीआईज के साथ होता है. एम्पाग्लिफ्लोजिन जो है वो कार्डियोप्रोटेक्टिव होते हैं. For an obese patient newly diagnosed type 2 DM, which class of oral antidiabetic is typically the first line causing slight weight loss? तो फर्स्ट लाइन हम देते हैं मेटफॉर्मिन और वेट लॉस उसको बिगुनाइट्स भी कहते हैं. Pregnant patient with severe mitral stenosis develop AFib. Which anticoagulant therapy is preferred during the second and third trimester? That is your option number B, low molecular weight heparin. मैनेजमेंट कर रहे हैं प्री एग्जिस्टिंग डायबिटीज़ और gestational diabetes mellitus during pregnancy. Which medication is considered the gold standard for glycemic control because it is effective and does not crosses the placenta to affect the fetus? तो ये आपके साथ कौन सा है? That is option C, insulin. The characteristic rod-shaped tennis racket-like inclusion known as Birbig's bodies. Birbig's bodies आपको किस में मिलते हैं? Amongst the following: osteosarcoma के histiocytosis. That is histiocytosis. ठीक है, histiocytosis में आपको Birbig's bodies, tennis racket-like inclusions मिलते हैं. ये हमने पिछले वीडियो में भी पढ़ा था. Birbig's bodies are unique rod-shaped cytoplasmic inclusion found in the dendritic Langerhans cells and are pathognomic for Langerhans cell histiocytosis. For a patient experiences significant third space fluid loss, which class of intravenous fluid is the preferred choice for initial resuscitation to replace both water and electrolyte? तो फर्स्ट लाइन आपने क्या करना है थर्ड स्पेस फ्लूइड लॉस में? तो उसमें आपने देना है ऑप्शन नंबर डी, आइसोटोनिक क्रिस्टलॉइड्स. फ्लूइड लॉस इन थर्ड स्पेस की बात आ जाए तो उसमें आइसोटोनिक क्रिस्टलॉइड्स आपने देना है. उसमें रिंगर लैक्टेट आता है, नॉर्मल सेलाइन वगैरह आते हैं. What is the single most defining characteristic that differentiate bile from found in the gallbladder from the bile originally secreted by the liver? तो among the following ये आपको क्या लग रहा है? Bile in the gallbladder has lower concentration of bile acid. Bile in the gallbladder has increased level of plasma protein. Bile in the gallbladder had mucus added and significantly concentration. Bile in the liver had calcium that is removed in the gallbladder. Bile in the liver is significantly darker color than bile in the gallstone. So that is option number C. Bile in the gallbladder has had mucus added and is significantly concentrated. जो gallbladder lining है secrete करती है mucus in the bile. Gallbladder bile is highly concentrated, 20 times more than the hepatic bile, and contains more mucus, which is crucial for its function but also predisposes to gallstone formation. Certain bioactive compounds found in garlic are believed to exert hypolipidemic effect by inhibiting the HMG-CoA reductase. What is the expected physiological outcome of this inhibition on serum lipid levels? तो गार्लिक क्या करता है, ये आपके साथ अमंग्स द फॉलोइंग गार्लिक क्या करेगा, ये हमने पिछले लेक्चर्स में भी डिस्कस किया है, ठीक है। ये तो नहीं होगा, इन चारों में बताओ सिग्निफिकेंट चेंज तो है, एलडीएल पे ज़्यादा है ये मैं बता दूँ, ठीक है। तो एलडीएल को ये आपके साथ डिक्रीज़ करवाता है और इंक्रीज़ एलडीएल एचडीएल कोलेस्ट्रॉल। तो एलडीएल पे इसका काम होता है लाजमी, एलडीएल को डिक्रीज़ करवाता है और एचडीएल को ज़्यादा करता है, बैड लिपिड्स को कम करवाएगा, गुड लिपिड्स को ज़्यादा करवाएगा और कोलेस्ट्रॉल को भी ज़्यादा करवाएगा। What is the function of the enzyme HMG-CoA synthase in the cholesterol synthesis pathway? तो इसके लिए आपने कोलेस्ट्रॉल सिंथेसिस पाथवे सारा देखना होगा, उसमें HMG-CoA सिंथेस का काम क्या है कि इट कैटेलाइज द कन्वर्जन ऑफ एसीटोएसिटाइल CoA to HMG-CoA. A patient presents with generalized pitting edema which plasma protein level strongly suggests the edema is caused by decreased plasma oncotic pressure. तो कौन सी बात से पता चलता है कि एडेमा इज कॉज्ड बाय डिक्रीज प्लाज्मा ऑनकोटिक प्रेशर अमंग द फॉलोइंग, तो ये है प्लाज्मा प्रोटीन लेस देन 2.5. विच ऑफ द फॉलोइंग कंपाउंड is a naturally occurring catecholamine that acts as a hormone mediating the effect of sympathetic nervous system, that is your norepinephrine. In a case of acute tricyclic antidepressant toxicity, which clinical finding is expected? तो TCA में आपको क्या मिलेगी, इसमें आपको मेड्रिएसिस मिलता है. Which type of immune cell generally considered the first responders, ठीक है, फर्स्ट रिस्पॉन्डर्स इन द एडेप्टिव इम्यून सिस्टम टू कंट्रोल एंड एलिमिनेट सेल्स इन्फेक्टेड बाय वायरस, तो ये आपके साथ हो गए टी लिम्फोसाइट्स. A student is studying sensory receptors such as the photoreceptor in the eye and observed that the receptor responds proportionally to the intensity of the light stimulus. This property encoding stimulus strength is known as, तो इस प्रॉपर्टी को हम क्या कहते हैं, इसको हम ऑप्शन नंबर डी इनकोडिंग कहते हैं. इनकोडिंग क्या है, सेंसरी रिसेप्टर्स इनकोड करते हैं इंटेंसिटी ऑफ अ स्टिमुलस को by varying the frequency or magnitude of the action potential generated. Rate coding है allowing the brain to perceive stimulus strength. A fracture through the surgical neck of humerus is most likely to injure which major peripheral nerve that courses around this area, तो ये axillary nerve को damage करेगा. Patient presents with significant weakness in the flexion of the elbow and profound loss of supination of the forearm. तो supination कौन करता है, मस्कुलोक्यूटेनियस करवाता है, लॉस ऑफ सुपिनेशन है, ठीक है. मस्कुलोक्यूटेनियस आपके साथ लॉस ऑफ सुपिनेशन में फिर भी इन्वॉल्व होता है. द मैक्सिमम एक्यूरेसी ऑफ EtCO2 measurement is achieved when the sampling line is placed where to ensure the sample gas is least contaminated by fresh gas flow. तो among the following ये कौन सा होगा, that will be tracheal tube. To ensure EtCO2 accuracy, the gas sampling must occur with the sensor or line placed immediately at the tracheal tube connection, minimizing dead space and contamination from fresh gas flow. To achieve good analgesic and rapid induction of anesthesia when using the volatile agent halothane, which supplemental agent is typically combined with it, तो इसमें आपके साथ नाइट्रस ऑक्साइड होगा. In a patient with severe hepatic encephalopathy, which medication is the primary therapeutic agent used to reduce the circulating levels of ammonia, तो ये आपके साथ है लेक्टुलोज. Subdural hemorrhage है typically seen after blunt trauma result from tearing of which specific vessel, तो subdural में आपके साथ कौन सी चीज़ डैमेज होती है, उसमें सुपीरियर सेरेबेलर या सुपीरियर ऑफ्थेल्मिक वेन. Patient experiencing chest pain due to MI is given aspirin and sublingual nitroglycerin. How does nitroglycerin primarily relieves the MI pain? तो ये MI pain को रिलीव करता है directly reducing platelet by a dilation of the capacitance vessel, ठीक है, dilation of the capacitance vessels करवाता है, तो उसकी वजह से नाइट्रोग्लाइसरीन आपके साथ पेन को रिड्यूस करता है, डायलेशन करवाता है. When using ethylene oxide sterilization for heat sensitive medical device, What is the approximate duration required for sterilization phase at typical operating temperature? तो इसमें आपसे ड्यूरेशन का पूछा है कि ड्यूरेशन रिक्वायर्ड कितना होना चाहिए. दैट विल बी 4 to 6 hours. ठीक है, 4 to 6 hours आपने याद रखना है. ठीक है, ये हाईलाइट भी नहीं हो रहा. 4 to 6 hours. Which of the following non-depolarizing neuromuscular blocking agent typically exhibit longest duration of action? तो longest duration of action किसका है amongst the following? That is your option number B, doxycycline. doxycycline जो है longest duration of action है among the non-depolarizing muscle relaxant due to hypotension and reliance on renal excretion. Female patient has history of recurrent pulmonary embolism and continues to experience events despite being on standard oral anticoagulants. Which inherited condition is most common cause of recurrent venous thromboembolism? तो recurrent venous thromboembolism के लिए factor 5 लेडिन की म्यूटेशन होनी ज़रूरी है. फिर है an alcoholic patient with hypothyroidism presents with megaloblastic anemia. endoscopy पे ectopic gastritis नज़र आ रहा है. What is the best initial management step to treat the underlying cause? तो underlying cause को treat करने के लिए B12 दो को बालामीन replacement करो. What is the standard first line anticonvulsant medication used to prevent and treat seizures in patient with severe preeclampsia and eclampsia? तो उसमें preeclampsia eclampsia में अपने seizures को किससे prevent करना है? through magnesium sulfate. If a patient receives 2 liters of 5% albumin intravenously, approximately how much volume is retained in the intravascular space after short period considering albumin's high oncotic pressure? So that is your 2 liters. In Brown-Sequard syndrome, which modality is typically spared on the ipsilateral side below the level of injury? तो Brown-Sequard में आपके साथ कौन सा है? That is pain and temperature. A patient received Botox injection for cosmetic purpose in the face. Which side effect might be observed if the drug spreads? So that is dry mouth. ठीक है. 40-year-old male who used gutka presents with non-healing ulcer in the mouth. What is the most common associated malignancy? That is the squamous cell carcinoma. In DMD, the defective protein is dystrophin. The absence of this protein leads to muscle fibers fragility and instability, primarily resulting in abnormal cellular permeability. Which ion or molecule is involved? That is calcium ion. फिर आपके साथ है which muscle is not typically incised during emergency cricothyrotomy or a standard elective tracheostomy? That is your option D, trachealis muscle. Cis atracurium is preferred over stereoisomer atracurium primarily because which pharmacological advantage? Because significantly less histamine release. Ranitidine was historically preferred over cimetidine due to which pharmacological property? ranitidine को less CNS toxic है. Cimetidine may have administered preoperatively to reduce the risk of aspiration pneumonia. What is the primary action in this setting? तो cimetidine का प्राइमरी एक्शन क्या है? इट डिक्रीजेस द गैस्ट्रिक एसिडिटी. Which wall of duodenum is most common site for peptic ulcer and if that ulcer penetrates deep, which major artery is most likely eroded leading to GI bleed? तो posterior wall है, gastroduodenal artery involved है. Which of the following opioid analgesic is distinct from other because its administration at therapeutic dose frequently result in tachycardia? तो ये आपके साथ है पैथेडीन. थेरेप्यूटिक डोज पे टेकिकार्डिया कौन सा करवाता है? यह हमने पिछले लेक्चर में पढ़ा. दैट इज पैथेडीन. विच एंटी टीबी ड्रग वेल नोन फॉर कॉजिंग पेरिफेरल न्यूरोपैथी की बात आ गई. आइसोनियाजिड माइंड में आना चाहिए. बाय इंटरफेयरिंग द मेटाबॉलिज्म ऑफ पायरोडॉक्सिन, तो ये दिस इज आइसोनियाजिड. What is the primary neurotransmitter released by the postganglionic nerve fibers of the parasympathetic nervous system onto their targets? तो that is your option D, option B, acetylcholine. जो पोस्ट गैंग्लियोनिक है that is acetylcholine. प्री गैंग्लियोनिक में आपने लैम्बर्ट ईटन लिखना है. ठीक है, प्री गैंग्लियोनिक में आपने लैम्बर्ट ईटन लिखना है. फिर इसके बाद फीमेल patient presents with abdominal pain and mass in is found that upon imaging or pathology is shown to contain tissue component from all three germ layers including fully differentiated structure like teeth, bone and cartilage. What is the diagnosis? The diagnosis is dermoid cyst, which medication work by inhibiting the degranulation of mast cell and is primarily used as prophylactic treatment for allergic conditions such as mild persistent asthma और allergic rhinitis. तो ये आपके साथ सोडियम क्रोमोग्लाइकेट होगा. 5-year-old boy presents with hepatosplenomegaly and sparse hair. The combination along with other symptoms like recurrent infection suggest an inborn error of metabolism. तो ये आपके साथ क्या होगा? Menkes disease होगा. Female patient presents with jaundice gallstone, which biochemical markers is earliest most sensitive indicator of biliary obstruction before a CT scan. So that is your ALP and direct bilirubin. Nasopharyngeal carcinoma malignancy, particularly prevalent in certain population, has strong etiological association with which viral infection? तो इसका strong association है with Epstein-Barr virus. Patient presents with non-specific symptoms including abdominal pain, constipation, history of renal stone. What is the characteristic electrolyte abnormality? So characteristic electrolyte abnormality is your hypercalcemia. What is the primary factor that determines the partial pressure of water vapor in the alveolar gas given that the inspired air is fully humidified as it reaches the alveoli? So that is your body temperature. Where a patient involved in severe RTA develops swelling in the neck, especially above the clavicle. This suggests leak in the facial planes from the structure contained within or adjacent to the supraplular membrane. Patient involved in RTA presents with respiratory distress and visibly noted to have paradoxical chest movement. तो paradoxical chest movement आपको flail chest में नज़र आती है. Patient diagnosed with Cushing syndrome, उसको hirsutism develop हुआ. What is the direct cause of hirsutism? तो direct cause of hirsutism among the following is what? Direct cause of hirsutism among the following is increased production of adrenal androgen. How is aneuploidy defined? Aneuploidy को आपने किस तरह define करना है? By an abnormal number of chromosome in a cell. Patient with history of travel presents with lethargy and diarrhea of 25 days. Stool culture पे gram negative anaerobic rod नज़र आ रहा है. Which antibiotic is often used as alternative for severe or complicated enteric infection? Severe or complicated enteric infections के लिए azithromycin is used. ENT surgeon takes sample from nasal mucosa. Which cell type will be most numerous or characteristic cell? तो इसमें आपके साथ होगा pseudo stratified ciliated columnar. Which of the following intervention or agent acts to increase the competency of gastroesophageal junction sphincter? So that is metoclopramide. Which GI hormone acts to decrease the motility and acid secretion of small intestine? Motility and acid secretion को जो आपके साथ decrease करता है, that is your secretin. The prolonged action of phase 2 block following succinylcholine administration is most commonly caused by which of the following inherited condition? So it is caused by the deficiency of pseudocholinesterase. Phase 1 or phase 2 block are prolonged when metabolism of succinylcholine is delayed by genetic deficiency of the plasma pseudocholinesterase, which normally breaks drug down rapidly. A patient presents with right-sided thermoanesthesia on face and dysphagia combined with left-sided pain sensation lost in the limb. Where is the lesion located? So the lesion is located in the right lateral medullary syndrome. Person suddenly ascends to high altitude leading to compensatory hyperventilation. What is the resulting primary acid base abnormality? So primary acid base abnormality is respiratory alkalosis. Which of the following best defines an allele? तो best allele को कौन define करता है among the following? That is option C. A variant form of a given gene located at a specific locus on a chromosome. Which of the following is characteristic physiological change observed during the first trimester of pregnancy, driven primarily by hormonal changes? That is your decreased PCO2. During moderate steady state physical exercise, which of the following best describe the typical change in the partial pressure of oxygen and carbon dioxide in arterial blood? So that is due to normal PCO2. During moderate exercise, respiratory drive increase proportionally to CO2 produced, such that the arterial PO2 and PCO2 typically remains near normal. The initial emergency treatment and antidote for severe aspirin poisoning is focused on increasing the excretion of drug. What is the key IV therapy used? तो इसमें key IV therapy that will be used is sodium bicarbonate. Sodium bicarbonate IV. A patient with history of rheumatic heart disease presents with fever and new changing pansystolic murmur. Empiric treatment for native valve endocarditis in this setting involve which combination? तो ये आपके साथ कौन सा combination involve करेगा? That will be option B, penicillin and gentamicin. For surgical procedure like laparoscopic cholecystectomy, where intense abdominal muscle relaxation is needed for insufflation, which immediate acting muscle relaxant is often preferred? तो immediate सर्जरी के बाद सिस एट्राक्यूरियम आप यूज़ करते हो. Patient at 6 weeks of pregnancy with Graves' disease taking metamizole. TSH is low, T4 is normal. Given teratogenic risk of the current drug, what is the most appropriate medication? So most appropriate is switch to P2U. The beta blocker is frequently used in hyperthyroidism to manage symptoms like tremor and tachycardia. In addition to beta blockage, it possesses a unique pharmacological property that aids in reducing thyrotoxicosis. What is the secondary action? So it inhibits peripheral conversion T4 to the active T3. A patient diagnosed with cerebellar lesion presents with intentional tremor and difficulty buttoning shirt. Which sign is most specific characteristic used to confirm a kinetic cerebellar defect? So that is option A, dysdiadokinesia. Patient is having a progressive neurological disorder characterized by tremor, rigidity, bradykinesia. तो ये ट्रायड आपको किस चीज़ में मिलता है? सब्सटेंशिया निग्रा पार्किंसोनिज्म में. A patient who can understand language but cannot speak fluently. तो अभी फ्लुएंट स्पीकिंग नहीं कर सकता. दैट इज़ ब्रोका इन्वॉल्व. ब्रोका इंफीरियर फ्रंटल में होता है. Exposure to UV radiation is leading cause of skin cancer and causes DNA damage. This damage commonly result in inactivating mutation in which key tumor suppressor gene? So key tumor suppressor gene, that is TP53. A patient with severe aortic stenosis frequently experiences episodes of syncope. What is the primary underlying hemodynamic mechanism responsible for syncopal episodes? तो सिंकपल एपिसोड्स के लिए कौन से आपके साथ रिस्पॉन्सिबल है? दैट आर योर ऑप्शन नंबर सी, फिक्स्ड आउटफ्लो ऑब्स्ट्रक्शन. विच सेगमेंट करेक्टली डिस्क्राइब electrophysiological event represented by a component of the normal ECG? तो P wave shows pacemaker depolarization. R wave changes shape in AV block. PR interval shows time from atrial depolarization to ventricular repolarization. यही ठीक लग रहा है बिल्कुल. ST segment represents the period where the entire ventricle is depolarized. तो the correct option is option D. Option D सबसे accurate है. ST segment on the ECG corresponds to plateau phase of the ventricular action potential, during which the entire muscle of the ventricle is depolarized. Which gas law describes the physical principle governing the tendency of a gas to dissolve into a liquid? That is your Henry's law. The temperature at which the vapor pressure of liquid substance is equal to the surrounding atmospheric pressure, इसको हम क्या कहते हैं? इसको हम boiling point कहते हैं. This is called the boiling point. Patient presents with inability to move the eyes laterally to look right or left. Which cranial nerve is most directly implicated in generating this movement? तो इसमें cranial number 6 is involved. ठीक है. A patient is stung by bee, develops laryngeal edema and given adrenaline. What type of shock is the patient experiencing? तो ये anaphylactic shock है. Pain sensation from hand from heart palate such as that caused by trauma is transmitted by which nerve? So that is by option number B, greater palatine nerve. Pseudomyxoma peritoni characterized by accumulation of mucinous ascites and gelatinous implants on the peritoneal surface spread primarily by which mechanism? तो ये spread होते हैं through ऑप्शन सी डायरेक्ट सीडिंग. सूडोमैक्सोमा पेरिटोनाई की बात आ जाए तो ये डायरेक्टली सीडिंग के थ्रू आपके साथ ट्रांसफ़र होती है. कंडीशन इज spread by rupture of mucinous tumor which releases mucus secreting epithelial cells that seed and implant directly onto the peritoneal surfaces. Which cell type is considered the major scavenger of the immune system responsible for phagocytosing cellular debris, pathogens, and apoptotic cells throughout the body's tissue? So that is your option number D, macrophages. An asymptomatic patient is found to be anti-HCV positive. What is the most appropriate next step in management? The most appropriate next step in management is test for HCV RNA PCR to confirm active infection. 50-year postmenopausal female is diagnosed with breast carcinoma that is both estrogen receptor progesterone receptor positive. What is the preferred initial endocrine drug of choice for this patient? So that is your aromatase inhibitor. Patient presents with history of saddle nose deformity and chronic sinusitis accompanied by rapidly progressive glomerulonephritis showing a crescenteric pattern on the renal biopsy. Which condition is the most likely diagnosed? तो इसमें आपको सैडल नोज डिफॉर्मिटी और ये ग्लोमेरुलोनेफ्राइटिस क्रेसेंटेरिक पैटर्न है, ये आपको ग्रेनुलोमेटस with polyangiitis, granulomatosis with polyangiitis Wagner's में मिलता है. ठीक है. A non-pregnant patient presents with heavy PV bleed that have persisted for 6 months. What is the initial management strategy for heavy menstrual bleeding? So that is give antifibrinolytic agent. Injury to which nerve cause classic winging of the scapula? तो long thoracic nerve है. The mother of infant reports absent right testicle but ultrasound confirms its presence in the abdomen. What structure plays the essential role in the final descent of testes from the inguinal canal into the scrotum? तो among the following ये कौन सा है? That is your option B, gubernaculum. Gubernaculum crucial ligamentous cord है that is thought to guide and tether the testes mediating the final phase of testicular descent into the scrotum. Patient with history of bilateral inguinal hernia is likely to have defect related to which specific anatomical structure in the inguinal region? So that is your option number C, processus vaginalis. A patient with mitral stenosis develop an ischemic stroke due to a cardioembolic event. What is the characteristic type of necrosis in the brain? तो ब्रेन में लिक्विफेक्टिव होता है. साइनाइड पॉइजनिंग, यहाँ से आपको डायरेक्टली पता चलना चाहिए कौन से कम्प्लेक्स को इनहिबिट करता है. कम्प्लेक्स 4 को. इज़ रैपिडली फेटल बिकॉज टॉक्सिन इनहिबिट्स विच स्पेसिफिक एंजाइम? दैट इज़ कम्प्लेक्स 4. तो ये मैंने आपको फर्स्ट एड से पढ़ाया है. फॉर अ पेशेंट प्रेजेंट्स विद हाइपरकेलीमिया विच क्लास ऑफ डायूरेटिक शुड बी स्ट्रिक्टली अवॉइडेड? तो पोटाशियम स्पेयरिंग नहीं देना क्योंकि वो इसको और ज़्यादा करवाएंगे. पोटाशियम स्पेयरिंग स्पाइरोनोलेक्टोन. A patient with a UTI is found to have organism that is gram negative rod and is observed to be swarming mortality on blood agar. तो swarming mortality आपको protease में मिलती है. During the phase of prolonged fasting after glycogen stores are depleted, what is the primary fuel source utilized by the brain? That is your option D, ketone bodies. A patient falls from a height landing on her back. She complains of urine incontinence and perineal pain, numbness. This injury suggests damage to which specific group of sacral nerve roots supplying the bladder and perineum? तो ये आपके साथ होगा ऑप्शन सी, S2 to S4. Perhaps male patient sustained penetrating trauma to the chest wall. He subsequently has difficulty with initial abduction of the shoulder and raising the arm, indicating weakness in the supraspinatus muscle. Which nerve is most likely damaged? That is your suprascapular nerve. 65-year male with neurodegenerative disease undergoes EEG. Which pattern is typically seen, indicating decreased brain activity? So that is your slowing of the background rhythm. In many progressive neurodegenerative disease, EEG shows characteristic slowing of the normal background rhythm with increased presence of slower theta waves and delta waves. A male patient उसको pleural effusion है, requires chest tube insertion. What is the key anatomical landmark that dictates the safe placement of the needle or tube related to the rib to avoid neurovascular bundle? That is upper border of the rib में. A doctor who is well spoken appears on television and approached by cosmetic company to advertise their product. According to the medical ethical guideline regarding professional integrity, should the doctor accept ethical if the product is tested and safe? No. The doctor should refuse as advertisement commercial product compromise professional objectivity. Option B ठीक लग रहा है. Accept the offer only if she verbally and visibly discloses her full financial agreement with the company during the. ये भी ठीक नहीं है, आपने बस नहीं एक्सेप्ट करना, किसी भी तौर से आपने एक्सेप्ट नहीं करना. 70-year-old male complains of urinary symptoms and bone pain. PSA जो है 50 है. हमारे वाले तो सारों ने एक्सेप्ट ही करना है, ठीक है, इस वाले के बारे में, लेकिन आपने लिखना है कि नहीं एक्सेप्ट करना. 70-year-old male complains of urinary symptoms and bone pains. PSA 50 है, indicating prostatic CA with likely metastasis. Which lobe of prostate is the most common site of origin for prostatic carcinoma? तो prostatic carcinoma के लिए posterior lobe होता है. ये हमने डिस्कस किया भी है ऑलरेडी. अच्छा, इसके बाद है, आपने ये वीडियो बंद नहीं करनी, आपने पहले सब्सक्राइब करना है, फिर आपने ये वीडियो बंद करनी है, क्योंकि मैंने इतनी एफ़र्ट की है आपके लिए. सारे इसके वॉल्यूम 2 के सारे पेपर्स अवेलेबल किए हैं. तो आई वुड ग्रेटली अप्रिशिएट अगर आप सब्सक्राइब करें इस चैनल को और काइंडली अपने फ्रेंड्स के साथ इसको शेयर करें. सो थैंक्स फॉर वॉचिंग एंड इंशाल्लाह इसके बाद मैं एरेटा भी शेयर करूँगा. एरेटा आ जाए तो उसमें जो MCQs गलत हैं उसकी एक वीडियो एंड में डाल दूँगा. तो सारे वीडियोस को आप पहले देखें और एंड में फिर एरेटा में जो गलत हैं वो वहाँ से हम ठीक कर लेंगे इंशाल्लाह, ठीक है. सो थैंक्स फॉर वॉचिंग एंड बेस्ट ऑफ लक फॉर योर एग्ज़ाम.